Imagine a time when surgery meant drilling into your skull with a hand-cranked metal spike while you were wide awake. Welcome to the brutal world of medieval brain surgery, where survival wasn't just rare, it was a miracle. Today, we're uncovering how patients endured one of history's deadliest procedures, and why 9 out of 10 never lived to tell the tale. We'll reveal the barbaric tools they used, the shocking remedies for pain, and the handful of survivors whose skulls still baffle historians. Spoiler: this isn't for the faint of heart. Meet the medieval neurosurgeon, often a barber, monk, or blacksmith with zero medical training. Their tool of choice? The trepanation drill, a hand-cranked spike designed to bore holes into the skull. Why? To release evil spirits causing madness, seizures, or headaches. Surgeons targeted specific skull regions they believed housed demons. No anesthesia, no sterilization, just brute force. Patients bit down on leather straps. If they were lucky. The goal: remove a circular chunk of skull. But with shaky hands and filthy tools, death often came from infection, brain damage, or sheer blood loss. Against all odds, some survived. Take Skull 107 from a 12th century French dig site, a peasant who lived years after trepanation. How? Let's dissect the 1% who cheated death. This 14th century skull shows bone regrowth, proof the patient survived. Historians speculate they were nobility, receiving elite care, maybe opium for pain, or a steady-handed surgeon. Post-op care? Rotting meat to draw out evil, wine-soaked bandages and prayers. Survival relied on sheer luck, or a skull thicker than the drill. While most surgeries were lethal, trepanation accidentally worked for skull fractures. Drilling relieved pressure, saving lives, but only if the surgeon didn't stab the brain first. Ironically, the dirtiest surgeons had better survival rates. Their tools? So caked in blood and rust, they'd accidentally cauterize wounds, slowing infection. For mental health? Useless. But for head injuries? A grim 1 in 10 chance. Still better than praying. Next time you complain about a headache, thank your lucky stars you weren't a medieval patient. If you'd rather keep your skull intact, hit subscribe and join us next week for the 1600s plague doctor who killed more than he saved.